Good day, folks. Thank you for joining us here at Your Health. Say, you know when you go to the doctor and you get your physical and they do a little lab work and the doctor sends you a copy of those lab results and maybe there's a CBC, a complete blood count, a chemistry, a metabolic profile, liver enzymes, thyroid level, cholesterol. You know what you get in your physical lab work. Do you know what all that really means and how to interpret it and steps you can take to correct any abnormalities in your lab tests? You probably don't unless you're a doctor or a nurse. You've never been trained in those things. Well, finally, we have a book that will help you manage your laboratory values. Dr. James LaValle is with us today. He's a great guy. He's unbelievable depth of knowledge, and he's just a good person all around. It has taken him 3 years to write this book, but believe me, it's worth the effort. Every family that watches this program should have a copy of this book to help them understand what their lab values mean. It's so important to do this right. So stay tuned for our program concept today, because this will change your attitude towards those lab reports. Now you have good information to deal with them. So it's very important. But let's go to our news first, then we'll come back and talk with Dr. LaValle. Let's do our news. Sudden cardiac death may not be so sudden, finds new research from the American Heart Association. Researchers from Cedars-Sinai Heart Institute followed over 1 million residents of Portland, Oregon for 12 years. They carefully evaluated every case of sudden cardiac death. They found 567 men that had suffered from sudden cardiac death. Of the men whose heart stopped, 53% had early warning signs of impending heart trouble. They found the most common early symptoms were chest pain, shortness of breath, dizziness, fainting, or palpitations. The American Heart Association reports about 360,000 Americans suffer from heart stoppage outside of the hospital every year. Well, folks, this one's critically important. If your heart stops beating outside of the hospital, you only have a 1 in 10 chance of surviving. So any information that could help us predict who is susceptible to sudden heart stoppage, well, that could save thousands of lives, couldn't it? This remarkable study found that over half of the time, there were warnings of heart troubles. The signs again, chest pain was far and away the most common symptom. 56% suffered at least some chest pain before their heart stopped. This was followed by shortness of breath and a sensation of dizziness or even fainting. Folks, we often have aches and pains, and of course we can't run to the doctor every time something starts to hurt a little bit. But the chest pain associated with heart troubles is not like the soreness associated with too much weekend work. The chest pain of heart disease is more like a squeezing, a constriction around the chest that is often made worse with physical exertion. The chest pain of heart disease also creates a feeling of impending doom or a sense of anxiety that is often accompanied with shortness of breath. In short, if there is anything unusual or odd and different about the symptoms associated with your chest pain, it is best to have it checked out immediately. Vitamin D deficiency may increase the risk of cardiovascular disease. New research reported in the European Heart Journal finds those with vitamin D deficiency are 7 times more likely to develop coronary artery disease. Researchers evaluated 252 patients with heart disease. They also found 88% of the study subjects had vitamin D deficiency. That's almost 9 out of 10. Related research reported in the Medical Journal of Pediatrics finds childhood vitamin D deficiency increases the risk of anemia. Researchers from Johns Hopkins University evaluated over 10,000 kids. They found if the child had a vitamin D level below 30 nanograms per deciliter, they were twice as likely to also have anemia. Folks, these two studies do not prove vitamin D deficiency causes heart disease or anemia, but they certainly raise a red flag so that researchers can design studies to find out if vitamin D deficiency causes heart disease and anemia in kids, or if it's just an association. But this does not mean you should wait to start supplementing vitamin D until they sort this all out. We know way too much about vitamin D's other health benefits. Children should take 1,000 units of vitamin D3 daily, and this dose should suffice until they are near adult weights. Then they should take the same dosages as adults. Getting our kids outdoors for a little physical play would also help. Our next story has more. Children's cardiovascular fitness is declining worldwide. Researchers from the American Heart Association reviewed 50 studies from 1964 through 2010 involving 25 million kids from 28 countries. They gauged cardiovascular endurance by how far kids could run during a set time. They found children's cardiovascular fitness has declined by about 5% per decade beginning in the 1960s, and the trend held true in all of the countries studied. They also found today's kids are about 15% less fit than their parents were when they were children. Boy, this should concern everyone who hears of this study. Today's kids worldwide are out of shape, and this puts them at risk for a plethora of diseases later in life. This study found that it takes today's children 1.5 minutes longer to run a mile than the kids of just 30 years ago. The study's authors point out that 30 to 60% of this decline is due to the fact that today's youth carry too much fat to be in great shape. They also were quick to remind us that kids require 1 hour of physical activity every day in order to assure proper growth and development. And of course, no one can exercise for us. So parents, I urge you to make family exercise a priority. Your children's fitness level will benefit as well as their grade point average. Folks, today is a special day here at Your Health. Dr. James LaValle joins us. Dr. LaValle is a registered pharmacist and a certified nutrition counselor. His depth of knowledge is most impressive, and he has written a very practical book, Your Blood Never Lies: How to Read a Blood Test for a Longer, Healthier Life. Sure, we all save our medical lab reports, but what does all that lab data mean, and what can we do about them? Well, finally, we have a book written for lay people to help us understand exactly what these medical labs reports mean. Stay tuned, folks. We'll be right back.
Savings time is here again with our annual cancer-free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. I'm Cindy Becker for Your Health at a Glance. We all have said, I need to get some exercise, but how many of us put on our walking shoes and go? Learning a little more about the health benefits of exercise may help you get motivated to lace up those walking shoes. Exercise helps to control our appetite and weight. It maintains strong muscles. It promotes the release of endorphins that counter depression while helping us feel good about our lives. Exercise helps to lower blood glucose, promotes a strong circulatory system, and controls cholesterol. Exercise even helps us get a good night's sleep. Recent research finds dog owners who regularly walk their pet are 34% more likely to achieve fitness goals. You can get all of these health benefits by walking 30 minutes 4 times a week, just 30 minutes a day. Start today, and you'll start to get all those benefits. For Your Health at a Glance, I'm Cindy Becker.
Do you believe that nature holds the answer to your health needs? Are you looking for a supplement that's simple and pure, yet really works?
If you're looking for nature's answer to better health, look to Aloha Noni Juice. It's pure and fresh, just like nature intended. Aloha Noni Juice is brought to you direct from the islands of Polynesia.
Aloha Noni Juice is 100% pure with no added sugar or sweet fruit fillers. It's the perfect addition to your low-sugar diet.
Aloha Noni juice drinkers will tell you their vitality, energy, and sense of well-being have improved, along with relief from many painful conditions. Made by nature, proven by science, Aloha Noni juice contains only nature's best.
And now you can enjoy the benefits of our new 100% certified organic Noni juice. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. Welcome back and blessings, everyone. We're very honored to have Dr. James LaValle with us today. He's a registered pharmacist and certified clinical nutritionist. Dr. LaValle lectures at the anti-aging conferences where Richard attends. That's where doctors gather to learn about integrative medicine. Today we'll be discussing Dr. LaValle's newest book, Your Blood Never Lies, How to Read a Blood Test for a Longer, Healthier Life. Welcome back, Dr. LaValle.
Oh, it's great being back.
It's such a great honor to have you here with us.
It's always fun to be here.
Good.
Well, Doctor, you've tackled a very difficult subject, laboratory medicine. Give us a little background on what led you to write a book for the layperson about one of the most complex scientific areas we know of. Talk about
Well, you know, it was interesting. After being in clinical practice a lot of years, you know, one of the number one things people would say to me is, well, I just got a call from the doctor's office and they said all my labs were normal. And I really felt that people needed to get more engaged in understanding what are your labs saying? You know, what do they mean to your health? And if the labs are trending out of normal, you should begin to understand that so you can be more proactive and not wait until a disease strikes, right?
Right.
So that was the whole purpose of the book. Years of just seeing patients waiting until the other shoe fell, for example, right? Instead of being proactive and understanding that there's a lot you can learn from your labs.
Yeah, now, which lab tests do you cover in this book? 'Cause, you know, there's thousands and thousands of varying lab tests. You focused on the most common ones.
Yeah, I really did. I covered things like what's called a CBC, you know, complete blood chemistry, which is looking at white blood cells and red blood cells. And then I looked at what was called a comprehensive metabolic panel, which measures things like, you know, liver function, kidney function, calcium in the blood, those kind of things. But then also looked at things like thyroid. Looked at homocysteine and C-reactive protein, looked at lipid panels, all the big major lab tests that a doctor is typically going to run. If you go into their practice and you get a lab test, I tried to cover the big ones because, yeah, there are literally, if you look at a LabCorp manual, it's, you know, super thick. There's, you know, 50,000 lab tests, right?
Right.
But these are the ones that concern most people, and you know what? If you can track these labs and keep them in balance, your chances and your risks are going to go way down and towards what's going to happen in terms of future health risks. So that's why I wrote about these ones.
Help us, how do they determine normal? Let's talk about that, because this is really one of the greatest parts of your book, understanding you can have a so-called normal result but be abnormal for you. Let's talk about how normal is established and how this applies.
Well, normal is established. It's called the 95th percentile, right? So they'll measure labs on people that don't have any kind of illness or disease that's known, and they literally acquire a normal range value within that 95% confidence interval. So that normal can be pretty big. Yeah. And that's the point I try to make in the book, is that normal is kind of an artificial normal. You could be a little bit out of range and still be normal, but more importantly, most people are trending out of range while they're still in normal. And that's what's important to understand, is that you're moving somewhere with your health, one way or the other. You're either getting healthier or you're getting sicker, one or the other.
Yeah, you know, there was a time, Cindy just mentioned this on the way over today, there was a time when doctors didn't even give you any lab results. Just come to me for everything, okay? Well, that has changed. Do you believe that change from the doctor controlling everything, changing to where the patient is more involved. Is this a good thing?
Oh, I think patient-centered healthcare is crucial for people really taking control of their health. If you don't understand what's going on in your chemistry, how can I expect you to be proactive? How can I motivate you if you don't understand what's going wrong with your chemistry? So yes, I think it's a really good idea. And you know what? I want the doctor to be the leader of that team that's centered around that patient, helping them to move forward towards their health.
You know, I can't help but think of scenarios where a lab test was done, it has an abnormal result, and no one ever calls the patient. They forget, it gets lost in the shuffle, and this is a reason enough to get involved in your laboratory results, don't you feel?
You know, I know how long you've been in practice, for years, and what you've said maybe happens all too often.
Yes.
One of the other motivations for the book was to say, you know what, put this on your on your desktop at home, and when you go in to get a blood test, make sure you request a copy so that you can look it over. Don't rely on someone else's judgment. It's your health. No one will care more about your health than you will.
Okay, let's do an example. Let's say I have a cholesterol and a cholesterol lipid panel type of thing. Right. If I were to get my results and go to your book, what could I learn about this?
Well, I think you can learn, first of all, there's different types of cholesterol tests. So there's a basic lipid profile that kind of says how much cholesterol do you have and what your triglycerides are, which brings up another point. You know, it used to be that, lab values that are healthy change. Yeah. So, for example, triglycerides are a part of your cholesterol test. The new optimum for triglycerides is 100. Used to be 150. Right. And so the first thing that you'll learn is, well, what are optimum values, and what does it mean if I have an LDL cholesterol that is high? And in fact, what the heck is LDL cholesterol? Right. I mean, most of the time, people, we assume as medical professionals, we talk to people and we think they understand the terms. And I have to tell you, lab tests are intimidating. You see all these numbers and you see all these names. And so the thing that you'll learn when you look at the lipid panel is, well, what's good cholesterol? What's bad? What about my triglycerides? And then there's advanced cholesterol testing, which I think also needs to be explained, because more and more doctors are doing that test. Yeah, we're not relying on just cholesterol nearly as much as we used to. Not at all. Not at all. There's so much more to it. And in fact, the biggest thing that you'll learn, I think, in the book is that I allude to the fact that if you're having lipid problems, you're probably insulin resistant. Right. That's the big, quotient behind it. Maybe environmental intoxicants, that could be an issue. Maybe your hormones are changing. But for the most part, any kind of lipid disturbance, the warning shot has to go out that there's a problem with glucose regulation. You know, one of the great features of your book is you don't just stop with, well, that lab test is abnormal. Good luck with all that. Good luck. Good luck. Good luck with it. You don't stop there. Right. You provide medicine alternatives and complementary herbal, vitamin, and nutritional support. That's right. In addition to lifestyle. I mean, I go through lifestyle and diet because, the reality is, if you're going to achieve health, we know today that you're going to have to get your sleep, you're going to have to manage stress, you got to make better selections with the foods that you're eating. And in addition to that, I like using dietary supplements when possible for people, and I always suggest that, but I never, ever think for a minute that drug therapy might be warranted, right? Because some people aren't going to follow a good lifestyle, and that's where drug therapy really actually shines through. Yeah, yeah.
That's a good point, a very good point.
You mentioned in your book, if your LDL, your carrier protein for cholesterol, LDL, is elevated, probiotics may be helpful. Right. I find that surprising compared to what we knew 30 years ago about intestinal flora and terrain and bowel flora compared today. Well, how have you responded? How do you react to that type of study? Well, no, for me, the next thing is, I think that when you realize that you have almost 1 million genes, in your body that aren't yours, that they're all the little probiotics running around, the microorganisms, I've really gained an appreciation for the microbiome and everything that it helps to control. So everything from the processing of fats and chylomicrons and how you utilize fats to how you're going to get rid of fats through digestion and elimination.
probiotics play a healthy role in that. And so, yeah, I think, you know, I think what the old story was, you know, people would say, well, I don't need to take probiotics. I poop every day.
Right.
Right? That was,
Right.
I mean, literally, that's
Yes.
what they would say to you.
Yes.
And,
I'm regular.
Yeah, I'm regular, yeah. And which is the same thing as I'm normal. You know, what is normal, what is regular, right?
Right.
But the reality is that probiotics play such an important role from everything from immunologic, you know, regulation in your body to metabolism of your lipids. There's so many things that they control.
Yeah. Folks, we're headed to a break right now, but have you ever noticed on your lab report there's a list of lab results like ALT, AST, GGT. You know, have you ever wondered what that is, what it all means? When we return, we're going to find out what those enzymes are all about and what it means when they're elevated. We'll be right back.
Savings time is here again with our annual cancer-free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. I'm Cindy Becker for Your Health at a Glance. How often do you go into the grocery store to buy just a bag of chips or candy bar? I suspect not very often. Then how is it that these foods make it into our grocery bags and pantries? Do you make impulse choices and buy junk food? To control that impulse, plan your next trip to the store. Write down at least 3 days of menus and build a grocery list with the ingredients needed to prepare the meals. Eat a healthy snack before going to the store. If you are hungry, you're less likely to stick to the grocery list. Shop the perimeter of the store, starting with fruits and vegetables. Have you ever noticed the most healthy foods are in the outer aisles? And avoid items displayed at the checkout counter, trying to entice you to make a last-minute purchase. Follow these tips and make a plan so your next trip gives you control and you come home with bags full of healthy food. For Your Health at a Glance, I'm Cindy Becker. Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastrodefense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128. We're back, everyone, having a great discussion with Dr. LaValle about his newest book, Your Blood Never Lies. This is so fascinating. Everyone, you've got to get this book today. It is fabulous. Now, Dr. LaValle, Richard said before the break, and that was a good point, let's talk about liver enzymes and why it's important to follow them when they're elevated. Some people say, oh, well, my liver enzymes were just a little elevated. I'm not worrying about it.
Don't worry, it's just a little.
It's just a little.
Yeah,
right.
Let's talk about it, and then we'll address that it is covered in the book.
Yep.
Well, the first thing you should know is that if your liver enzymes are elevated, that you have some liver damage that is taking place, most likely. Even when it's slightly elevated, we know that those enzymes are going on because either there's some damage, there could be an infection, There could be any number of things that are going on.
Or you're on a medicine that's harming your liver.
Good point.
And as a pharmacist, you're very aware of that.
There's a lot of drugs that, a lot of people today are in a polypharmacy situation, right? They're taking multiple drugs, and they should, without a doubt, if you're out there and you're taking prescription medications, you should be getting your blood tested at least 2 to 3 times a year, just to make sure your liver is reacting well to those medications.
And just because you took the medicine safely for 10 years doesn't mean the next 10 years will be safe.
That's such a good point, Dr. Becker. I mean, the whole process with taking medications, you just have to realize there's a threshold of how hard that liver is working to process things. So, for example, one is called a GGT, a gamma glutamyl transferase.
Easy for you to say.
Yeah, that's a mouthful.
How about that one?
But what's neat about GGT, it's a way of measuring how your body's using glutathione and working with glutathione.
Oh, very important.
And what's really interesting is they're linking it now to cardiovascular disease, so that as your GGT...
See, this is new to me.
This is kind of new information.
Thank you for coming today.
Right.
Okay, can I interrupt?
Sure, of course.
A silly question, because I want everyone at home, because they're writing this down, and I want them to know.
Sure.
When you say a liver enzyme, are all these tests in a panel, or at home, do I need to say, I want to have this GGT tested?
Well, you know what? That's a great question, because sometimes people will only do what's called an ALT and an AST, and they won't do a GGT. That's a really good point. So if you want a full hepatic panel, you should ask, I want a full hepatic panel. GGT's kind of stepped off, and Doctor, you could probably, speak to this, but it doesn't get measured all the time anymore.
It doesn't. You have to ask for it.
And there's some very interesting, data points around it, like I said, about glutathione and how well your body is producing glutathione, but more importantly, future cardiovascular disease risk. It's really new, novel information that they're showing, but it makes sense, because if your glutathione pool is low, that means you're under excessive oxidative damage.
Right.
And that's the hallmark of cardiovascular disease, right? The vessels are getting damaged.
So doctor, if I have an enzyme, a liver enzyme that's elevated, tell me what your book will do for me. What causes...
Sure.
Just go through it.
So one of the big ones for liver enzymes, if you don't have a viral infection, for example.
Like hepatitis.
Hepatitis of some kind, that's right. So if you have elevated liver enzymes, one of the most common causes of that is fatty liver. Right? And why is that? Why is fatty liver a problem? Well, once again, that's a problem with insulin resistance. And so one of the things that we do is we tell people to get on a lower carbohydrate diet, not a low carb, but to cut the refined sugars, the white flours out, change the diet like I know you've written about for years and talked to your folks about for a long time. But it's getting the diet right. But then there's things you can take that can actually help your liver enzymes come back to normal, and you can have a restorative effect on your liver. So milk thistle extract, for example.
Your recommendation, they're in the book.
Absolutely.
What you can do about this.
Absolutely.
It's very practical.
Right.
Very practical.
It's about what supplements can you take that have evidence, and then what's the diet choices and lifestyle choices you should make in order to help create a correction. Now, here's the thing. If you're on medications and you may not be able to make a choice as to whether or not your liver enzymes are slightly elevated, using agents like milk thistle or aged garlic extract, both of those have been shown to protect the liver when you're taking medication.
Right. So if I have, let's say we do an ALT, alanine aminotransferase. This is a liver enzyme, part of that panel. It tells us what normals are. It tells us what causes a high ALT, everything from influenza, liver disease, mononucleosis.
Right.
The medications that can do this to you, well, I'm on this one right here, and well, no wonder my ALT. Medications can drive up those liver enzymes.
Absolutely, that's the point. And a lot of times, like you said, people could be on a medication for years. And I wrote a book on drug-induced nutrient depletions. Actually, I've written several books related to that. And one of the things people don't realize, when you take a medication, typically what you think is, well, if I don't get a swollen eye, or if I don't get a rash, or if I don't stop breathing, I'm not having a problem with that medication. But the problem is that over years of taking that medication, it's altering different enzymes in your body and changing physiologic functions in your body. And so that medication, you need to watch that like a hawk as long as you're on that medication.
Doctor, you're an expert in medications. In general, do we over-rely on them in this country?
I would say, without a doubt, I mean...
In general.
In general, and look, I taught 17 years at the College of Pharmacy at the University of Cincinnati. I believe in medication. Yeah. I know modern medicine saves people's lives. But for the chronic health needs that people have, I said chronic health needs, not disease needs, because I want people to get chronic, to the point of chronic health. I want them to be healthy on a regular basis. Medications don't always serve as the best logical first step. You need them when you need them. And the more compliant a person is, the better off they'll be, and they won't need to rely on so many meds.
Wonderful. You know, here's the next one, the alkaline phosphatase. We're still in the liver enzymes. What causes elevation of that, what normals are, medicines that can cause it. But what I really like is you spend considerable effort and time helping the reader to understand the natural supplements.
Right.
The benefits of the garlic. Magnesium I didn't know magnesium would help elevated LP.
Well, it sure does, because it helps to regulate phase 1 detoxification in the liver. It's one of the principal minerals needed for all of the cytochrome P450 enzymes to function appropriately. Wow. So if you don't have the minerals that you need, your liver takes the brunt of the damage, right? Because they can't function and do what it's supposed to do.
I'll tell you what, we're going to a break now, but our nation has an epidemic of diabetes and high blood glucose levels. Can you have, don't answer now, because we've got, I want to know the answer to, can I have high glucose levels and not be a diabetic? What does it mean when the sugars are high when we return?
Savings time is here again with our annual cancer-free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. I'm Cindy Becker for Your Health at a Glance. Each year, more than 76 million Americans contract food poisoning. Most cases are caused by tainted fruits and vegetables, especially contaminated leafy lettuce. But poultry causes the most food poisoning-related deaths. To prevent food poisoning, follow these simple rules. Thoroughly wash all fruits and vegetables. When preparing any kind of meat, wash your hands, utensils, and work area before preparing any other food. Cook thoroughly chicken and ground meats. Store leftovers in the refrigerator immediately. Look for expiration dates when you shop. If you use reusable grocery totes, wash them periodically. And finally, use spices such as garlic and oregano to inhibit the growth of bacteria that cause food poisoning. Food safety lowers your risk significantly of getting sick. For Your Health at a Glance, I'm Cindy Becker.
Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why BioInnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health.
Because chances are you are one of the 200 million Americans who need more magnesium every day.
Again, that number is 888-442-2128. Call today. Ask about the AutoShip program for additional savings. We're back, everyone, having a great discussion with Dr. LaValle about his book, Your Blood Never Lies. Fantastic book. I'm telling you, I can't put it down. You know, to help you get this book today, I want to give you a special that's going to make this available for you to get. You could get several copies, pass it around the neighborhood, give one to your doctor, give one to anyone who's dealing with health issues or cares about their health. So with your purchase of your Noni today, whichever type you want, the organic, the regular, or the concentrate, you're going to get a copy of this brand new book free. That's today only, so don't miss out on it. I was just reading in here during the break about blood glucose levels. That's a really interesting subject today. As you know, diabetes is at all-time highs. So we need to understand a little bit more about what all those blood tests mean. Dr. LaValle, maybe, I mean, and I hear this from people who call in frequently, maybe they were told their blood sugar was 103, 102, something like that.
Technically normal.
Is that anything to worry about?
Well, you know, that's
And
once
what does
again,
it mean?
It's a good question, and I go through this and explain the latest information. Kaiser Permanente looked at 47,000 lives over 10 years.
Wow.
Everybody was in normal that they looked at in order to look at them over those 10 years.
Normal glucose levels.
Normal glucose between 65 and 99, and every 4 points they put them into a group. And you know what they found out after 10 years?
What?
For every point over 84,
That low.
it represented a 6% risk of becoming a diabetic.
Wow.
So if you have 100 at 16, right? 16 points
right,
over
right.
84, that is, believe it or not, a 96% risk of being a diabetic in your next decade. So when
that's
you
a
have a
sign.
102, what I tell people when they have a 102 blood sugar, my friend, you're already diabetic. Nobody's told you yet.
Right.
You're already
See,
there.
This is a perfect example of it provides the benefits of this book. Normal blood glucose levels, but it's not normal.
That's
it's
right.
maybe normal for somebody else, but not for you, perhaps.
That's exactly
and,
right.
And you give us what to do about it, what measures are best. I see, and you can extrapolate that to all the other lab tests as well. Same concept here.
Well, see,
Right.
honey, he's got an entire section on glucose that explains what it is. A lot of people don't know. I mean, if you don't work in a doctor's office, how would you just know this?
That's right. Well, people hear,
You know?
I got a touch of sugar.
Good touch
Right.
of sugar.
Right?
Right.
I got a touch
Right.
of sugar. Well, a touch of sugar is damaging your arteries,
Right.
eroding your brain. You know, Alzheimer's is considered type 3 diabetes now. That's
right. Right.
Damages your kidneys.
Right.
So, I mean, this is a big, big issue. And once your blood sugar is at 90, this is what the
Okay.
big study showed.
Okay.
Once you're at 90, the damage to the capillaries is already beginning. And people are being told all the time, hey, your numbers are fine at 94.
Well, maybe you don't need a drug at 94,
No.
but you need intervention.
You
need
do.
to change some
You need
things.
lifestyle changes,
yeah.
nutrients. I mean, actually, what I go through in here is that, you know, magnesium, even all of our government studies show that magnesium status is critical to preventing your future risk for diabetes and metabolic syndrome. It's the
Finally
number
admitting
one
it.
nutrient associated with it. Over thousands of people studied.
But you'll also learn from the book that chromium is also associated.
Chromium?
Very complete list.
Alpha-lipoic acid, important, right.
You know, folks, we have Gary waiting online, and he's had some trouble with his blood sugars. This would be perfect for him if we could talk to him now. Shall we go to the phones and talk to Gary?
Sure.
Gary, are you there?
Yes, sir, I am. How are you all today?
We're doing great. How are you, and how can we help you?
Okay, I used to be a bodybuilder,
Oh, okay.
and I ended up getting double hernias because I was lifting more weight than I should. And at that time, I was exercising regularly and everything was good. But I developed peripheral nerve damage in my groin from the surgery to where I can't run like I used to. I can't play basketball like I used to. So my sugars went from being like they're like a yo-yo. Like my last blood test was pre-surgery, and my glucose was 86. And then, but right before that, it was 114.
Were you fasting with the 114?
Yes.
Yes. Okay, so it's up and
And
down.
I was fasting with the 86.
So have you been told you're a diabetic? What's your status now?
I was told that I was pre and to take steps towards trying to prevent it. So even through the pain I'm walking a mile a day, 5 days a week, or working out on the Nintendo Wii Fit. I'm doing some kind of exercise 5 days a week.
Gary, did you know that between 30 and 40% of all diabetics are diagnosed due to the fact that they are living in pain, not because their blood glucose is high? Neuropathy can prevent first to the patient or to the doctor before anybody even knows they're diabetic. Yeah, and the next thing, Gary, you're very lucky because Dr. LaValle is also, are you still bodybuilding? You look in great shape, Doc.
Oh,
you do.
I've just worked the last 3 years, developed the whole program for Lifetime Fitness. 1.2 million members, developed all their nutrition and metabolism programs for them.
When I hear Gary tell the story, I think of magnesium, just exactly what you thought. Go ahead.
Exactly.
Go ahead.
Well, I'll tell you for a couple reasons. Magnesium is really good for pain management. Mm-hmm. And obviously, because of the level of activity that Gary does, that he's fighting through with the pain, he's going to use up his magnesium a lot quicker. So Gary needs to be up around 800 or 1,000 milligrams of magnesium elemental a day. In addition to that, chromium and then alpha-lipoic acid for any nerve damage or pain, you want to consider alpha-lipoic acid. And of course, omega-3 fatty acids are incredibly important as well.
What do you think of the possibility that the nerve damage to the inguinal nerves is actually a result of diabetes? It could be a possibility. It's possible.
Without a doubt, and that's why the alpha-lipoic acid is even more important, because in diabetic nerve pain, so in that situation, there's actually been some good data on alpha-lipoic acid helping to reduce the amount of nerve pain. So, diabetic neuropathy has some really good results with alpha-lipoic acid. And then the other one you want to think about is maybe something like grapeseed extract, just to kind of improve the blood flow and blood circulation at the same time. And the other thing I would say is that when you're in pain a lot of times you release more cortisol.
True.
Right? And
yes.
when you release cortisol, it causes the stress of the pain, right?
Yeah.
And cortisol can cause your blood sugar to go up. So I would have, if I was, Gary, I would get my cortisol measured, and if it's high, I would take steps to get that cortisol to come down. Something like there's several things. You could take theanine, you could take Relora, you could take holy basil, but try to do something to dampen the cortisol because that'll help the glucose and it'll also help the pain management.
Gary, are you still there?
Yes.
So are you getting the relevance of Dr. LaValle's new book, Your Blood Never Lies? Are you seeing how it could help you? Because everything he's mentioning is in this book, and you can come to understand and learn that just by reading the book. Now, here's what I want to do for you.
I'm seeing that.
I want to send you a copy of this book. I want to send you magnesium chelate and magnesium gel so you can take it by mouth and rub it on your painful areas. It helps tremendously. A little alpha-lipoic acid will be coming your way. I would not be surprised if after 60 days of this program, that pain starts subsiding and, it's better. I'm going to keep doing what I'm doing. Also, a little B12. What do we always say? If the nerves are bothering you, in any way the nerves are bothering you, please always include B12 in your treatment. A little fish oil to help those membranes.
Absolutely.
A little chromium picolinate, grapeseed extract with resveratrol. And of course the book's coming.
And the Noni.
And the Noni, great for the diabetic with pain too. What do you think, Gary? Do you feel like we're on the right track for you?
It sounds really good. Fish oil I take. And I also have like hypertension where I'm on 2 separate meds for that.
Well,
and,
this just confirms our suspicions that you're deficient. Anyone who exercises aggressively, and you have to do that to build big muscle, you're washing out magnesium with every single session.
Absolutely right, Doctor.
Okay.
I've seen it over and over again.
All right, Gary, your care package is coming. We're off to a break. We'll be right back.
Time is here again with our annual cancer-free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. Here is our hope for you today. I'm Cindy Becker. Do you feel that you'll never really be joyful and happy in your life? The Reverend Billy Graham wrote about these two emotions, joy and happiness. Dr. Graham says, joy is not the same as happiness, although they may overlap. Happiness depends on circumstances. Joy depends on God. In Psalm 30, David, whose life seemed an endless battle, experienced joy despite his problems as king of Israel. David wrote, "You turned my wailing into dancing. You removed my sackcloth and clothed me with joy, that my heart may sing to you and not be silent." If you are struggling to find joy in your life, pray to God. Count your blessings. Joy depends on God. I'm Cindy Becker. This is our hope for you today.
Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
So what can we do to get back in balance? We can eat a healthy diet.
And most of us need to supplement with omega-3 rich fish oil. Fish oil contains omega-3s with DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan and boost omega-3 to get back in balance.
To help you do that, BioInnovations offers two products, the Fish Oil Complex and Omega 369, both formulated for your health and well-being. So how do you choose? For highest levels of DHA and EPA, choose the Fish Oil Complex. For a balanced formula, choose the 369. Go online at bioinnovations.net or call 888-442-2128. Ask about the AutoShip program for additional savings. We're back, everyone. What a great time we're having learning all about this book, Your Blood Never Lies. What a great title and a really great book. I want to talk to Dr. LaValle here in a minute about the complete blood count. You know, that's the one thing they always do when you go to the doctor, isn't
CBC.
it? At least they'll do a finger prick and they'll do a CBC. So Dr. LaValle, I'm looking at this in part 4 of the book, which is fabulous. Talk to us about what the CBC means, why we care about if they want to do it, because usually they just say, oh, you're fine, and we just drop it at that.
Yeah.
Well, you know, it's interesting because I think it's one of the most valuable tests that you can get.
Absolutely.
You know, when your body can't carry oxygen, you're in trouble. It's that simple. You're in trouble. Because your cells are dying when you can't carry oxygen. And so finding out whether you're iron deficient, whether you're B12 deficient, whether you're deficient in folic acid, and once again, it's not even am I fully deficient, but as you become say you're slightly at B12 deficient, you're becoming more B12 deficient. Maybe you're on a drug that's depleting your B12 slowly over time, like a lot of the anti-ulcer drugs, right? The proton pump inhibitors or those kind of things. Metformin is really big for depleting B12. That's exactly right. And so the thing is that as my red blood cells, as that starts to grow, it's called your mean corpuscular volume. As that cell's growing, does a big cell get through a small garden hose very easy?
No.
It doesn't get through there very easy, does it?
It's hard for it to deform, too.
And it can't bend.
Get into the little nooks and crannies.
It can't bend and it can't get to all the tissues.
And that's the capillary where it counts.
That's exactly right, the microcapillaries, because we literally, at least my professors always said, we always die from the periphery in.
Exactly right.
You know, and
that's
so
what I've learned.
And so learning about, you know, how to look at your blood count is so important, because you find out, and you know what, a lot of people complain of anemia, and I can't tell you how many people that I found that have low iron, so iron poor blood, right? You hear that old term from the old Geritol commercials,
sure.
But iron poor blood's a real problem. People are iron deficient. The more you work out, like Gary, the more you work out, the more you dispose of your iron, because you're turning over your red blood cells when you work out.
Right.
And so there's a lot of men that are even iron deficient that don't know it, and they're wondering why they're feeling so fatigued and can't concentrate in the middle of the day.
Yeah.
Right? The other thing that's important about a complete blood count is your white blood cell count. And you can tell a lot about, you know, you hear about this term inflammation. You know, inflammation, the silent killer. Well, when you look at your white blood cell count contained within the CBC, if you're a, you know, I call myself a metabolic investigator, but if you're just savvy at looking at blood counts, like I know you are, doctor, you see that the body is starting to trend towards inflammation, that there's an underlying fire that's starting to smolder. It's not a full-blown infection. The immune system's not sending out a 5-alarm fire, but the monocytes, eosinophils, and basophils, which are 3 white blood cell subfractions, when they start to trend up, it's telling you that maybe you got some unfriendly bugs in the gut, that maybe you don't have enough probiotics, that there could be some chronic inflammation going on in your body. And the problem with chronic inflammation is eventually that damage, you know, takes on deeper and deeper toll on your body. So it leads to things like autoimmune disorders, heart disease, other chronic conditions.
You know, doctor, I'm thinking of a clinical scenario, and I'd like to get your opinion on it. Over my 20 clinical years of experience, I came to determine that the human body, if in a relatively pure state, in other words, you're not inebriated, your body, you are more sensitive in determining that something's wrong than the lab test.
Right.
For if you're a sensible person and you stay in touch and you're in tune with your body, you know it before the lab knows. What do you think of that?
You know, I think that without a doubt, if you're really in tune and you're listening, I think you can pick up on a lot of things early on.
Now, here's my point. If you're in tune like that and you feel something could be wrong and the lab report comes back, and remember that bell curve, you're on the edge of that bell curve. Technically normal, but now since you've read Dr. LaValle's book, you understand that since you're on the edge of that, that could be abnormal for you.
That's exactly the purpose of the book. I mean, the whole purpose was to let people know if you're feeling something. And this is the old story. I think we talked about it at break about thyroid. People go in, they get their lab tests, and they're told, oh, you're fine. Or if you're not fine, I need to give you an antidepressant, right? That's the classic, right?
Yes.
You know, and you're not fine, because if you were fine, you wouldn't be complaining about the way you feel.
Yeah.
That's right.
So there's something there, but maybe it's not a disease yet.
Right.
And that's what I really want to get across to people in the short time we have left, is that look at your labs, understand when you're trending out of normal that it could be leading you down a path, you know, towards an illness. If I'm 1 point away from being a diabetic, that's kind of like if I'm 1 step away from falling off the Grand Canyon.
Oh, no, I'm backing off. I've been there.
Do I want to go back, or do I want to step forward?
Yeah, right, exactly.
You want to go back. And so what are you going to do? What lifestyle tips? What nutrients? What are the courses of action you can take?
Great. Perfect. Folks, stay with us. We'll be back for the wrap-up.
Savings time is here again with our annual cancer-free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker for Your Health at a Glance. Are you looking for a way to lower your risk of Alzheimer's? As the prevalence of obesity and metabolic syndrome continue to increase, researchers have found a possible link between type 2 diabetes and the onset of Alzheimer's disease. In fact, type 2 diabetics are at 200% higher risk of Alzheimer's compared to people without diabetes. These metabolic changes that develop with diabetes appears to greatly increase the speed of deterioration of the brain and other related systems. Lowering your blood glucose is easier than you may think. Eat smaller meals, exercise regularly, and reduce carbohydrates in your diet, especially simple sugars. Taking steps today to control your blood glucose may protect your entire body, including your brain. For Your Health at a Glance, I'm Dr. Richard Becker. For thousands of years, Eastern health practitioners have used mushrooms for a variety of treatments.
And recently, scientists everywhere in the world have turned to mushrooms in search of health-promoting compounds.
These are known as medicinal mushrooms. Among some of the most potent are ABM, maitake, reishi, shiitake, and cordyceps sinensis.
At BioInnovations, we've made available 4 of the most powerful mushrooms in one easy-to-use formula. We call it the Mushroom Complex. We also offer the amazing mushroom Cordyceps sinensis in a standalone formula.
Cordyceps helps boost energy, an amazing discovery now used in both Eastern and Western medicine. So take advantage of thousands of years of health knowledge.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. Your Health is brought to you by BioInnovations, trusted products for your health and well-being. We're back, everyone. Just a little reminder to help you get Dr. LaValle's book today, Your Blood Never Lies. You're going to want to get this book, by the way, How to Read a Blood Test for a Longer, Healthier Life. It really will help you understand what all that means and what to do about it. Well, to help you get this book, when you purchase your case of Noni today, that's the organic, the regular, or the concentrate, you're going to get a copy of this book free. So don't miss out on it. This one is really a good one.
You know, we get a lot of questions about thyroid. My TSH is 4 and 4.5. I'm tired all the time. My doctor says it's fine. But you, in your writings, you say that 4.5 may not be quite so good.
Well, I'm just following the American Society of Endocrinology's guidance on this. I'm looking at the experts, and the experts say if it hits 2.5, you've got trouble.
Yeah.
So, you know, once you see a TSH over 2.5, typically that means your thyroid is starting to get a little sluggish. And remember, thyroid stimulating hormone was kind of the earliest thing everybody looked to kind of measure thyroid health. And really what we're interested in is things like free thyroid hormone, free T4 thyroxine, that's the thyroid hormone your gland makes, and then free T3. What your body does with that thyroid hormone, it has to convert it to the most active form. It's the active form we're the most interested in because that's what turns on all of your hormone receptors in your body. Pretty amazing, actually.
You know, you even have the most current lipid testing techniques, the VAP, vertical auto profile, and the NMR, nuclear magnetic resonance imaging. Folks, your doctor may not even know about this yet. But Dr. Sinatra was just with us, and he taught us that these are the best ways now to assay your cholesterol and cardiac risk. So I'm so glad you got that into the new edition.
I have to tell you, it's important because it's not, and I'm sure Dr. Sinatra harped on this, it's not so important if you make LDL cholesterol, it's what size it is.
Right.
Once again, you know, do you want to, if you're trying to throw a ball across into a tennis net, if it's a beach ball, you're not going to get it through the net. If it's a BB, it's going through the net. Your LDL cholesterol can be a BB or a beach ball. We want the beach balls.
You know, I can honestly say this is a good book, not only for the lay personnel, but for doctors and nurses, too. It's a compact, quick, easy reference you can use, and I would use this every day in practice. I really would.
I appreciate it. A lot of work and effort from my team.
3 years, it was worth the wait, brother, and thank you so much. Folks, this book should be in every family's library, in every church library, in every group of people who cares about their neighbors. It will help you. I hope you've enjoyed the hour, and I hope you've learned. Thank you so much for joining us here at Your Health. Goodbye, everybody. See you tomorrow.
Thank you so much, everyone. We'll see you tomorrow right here on Your Health. Bye-bye.
In watching Dr. Stanley all these years, he's still speaking the truth about hearing the voice of God and obedience. There's nothing added to it. There's nothing that he's taken away. It's just truthful. And then it's Dr. Stanley, and he is an amazing communicator. There's just no nonsense there, and that's what I love about him. You know, he's very honest about who God is and truthful, and that's essential in the world that we live in today.
Join Jim and Lori Baker every day as they welcome anointed teachers.
The result of our prayers will determine the future of our nation.
And the most dynamic personalities from around the world as we share grace and restoration.